Nerve agents. Nerve agents are extremely dangerous chemicals that attack the body's nervous system and are often considered some of the deadliest chemical weapons ever created. They work by blocking an important enzyme that normally breaks down a signal called acetylcholine, which nerves use to tell muscles when to move and when to relax. When this enzyme is blocked, the body is stuck in on mode, meaning muscles keep contracting without stopping. This quickly leads to serious symptoms such as tiny pupils, a runny nose, heavy drooling, sweating, difficulty breathing, and uncontrollable muscle twitching. As exposure continues, the body loses control of vital functions, causing seizures, paralysis, and eventually death, often within minutes, usually from the failure of the muscles needed for breathing or the heart. Nerve agents like sarin and VX are typically colorless liquids that can enter the body through breathing or skin contact, making them especially dangerous because they are hard to detect. They are generally grouped into two main types: G-series agents, which act quickly but evaporate faster, and V-series agents, which last longer in the environment and are more dangerous through skin exposure. Although treatments exist, including drugs that block the harmful effects and help restore normal nerve function, they must be given immediately to be effective. Even then, survivors often suffer long-term nerve damage, memory problems, and other lasting health issues. Because of how deadly and inhumane they are, nerve agents are banned under international law, but they have still been used in wars and terrorist attacks, which is why they remain one of the most feared forms of chemical warfare. Choking agents. Pulmonary agents, also called choking agents, are chemical weapons that attack the lungs and make it hard or impossible to breathe. They work by damaging lung tissue and causing fluid to build up inside the lungs, which slowly suffocates the victim. At the same time, they can burn and irritate the eyes and skin, leading to blurred vision and painful chemical burns. When someone breathes in these gases, the first signs often include a burning throat, coughing, chest pain, tightness in the chest, headaches, and vomiting. As the damage worsens, breathing becomes more difficult, and the body can go into respiratory failure, which can lead to death. Some well-known pulmonary agents include chlorine gas, phosgene, diphosgene, and chloropicrin. Among these, phosgene is one of the most dangerous commonly used agents. It is a colorless gas that is heavier than air, meaning it can stay close to the ground and linger, increasing the risk of exposure. One of the most dangerous things about phosgene is that symptoms may seem mild at first, but can suddenly become severe hours later, often leading to life-threatening lung damage within a day or two. Chlorine, while widely used in industry for things like cleaning water and making materials, can also be deadly in high amounts, depending on how much a person is exposed to. These weapons were first used on a large scale during World War I, especially during the Second Battle of Ypres in 1915, when German forces released a massive cloud of chlorine gas against Allied troops. Later in the war, phosgene became even more deadly and was responsible for the majority of chemical weapon deaths. Blister agents. Blister agents, also known as vesicants, are chemical weapons that cause severe burns to the skin, eyes, and lungs, leading to painful blisters and long-lasting damage. One of the most dangerous things about these chemicals is that their effects are often delayed, meaning a person may not feel anything for hours after exposure, only for serious symptoms to appear later. When they do, they can include red, irritated skin, large fluid-filled blisters, eye damage such as tearing and possible vision loss, and breathing problems if the lungs are affected. These chemicals can enter the body through the skin, eyes, or by breathing them in. And since they are heavier than air, they tend to stay low to the ground, increasing the risk of exposure. The main types include mustard agents, like mustard gas, arsenic-based agents, and lewisite, which acts more quickly and has an antidote. While blister agents are not always immediately deadly, they can seriously injure and disable people, often requiring long-term medical care because burns heal slowly and can become infected. They can also cause lasting health problems, including lung damage, scarring, and even cancer due to their effect on cells. These weapons were widely used during World War I, where they caused massive suffering, and today they are banned internationally because of how harmful and inhumane they are. Blood agents. Blood agents are fast-acting chemical weapons that harm the body by entering the bloodstream and preventing cells from using oxygen. Even though oxygen is still present in the blood, the body cannot use it, so cells begin to suffocate from the inside. These chemicals are usually colorless gases with a faint smell and are most dangerous when breathed in, especially in enclosed spaces where they can build up quickly. Once exposed, symptoms can appear within seconds and may include dizziness, weakness, headache, nausea, and trouble breathing. In more severe cases, people may suffer seizures, lose consciousness, and die within minutes. A notable sign of poisoning is that the victim's blood can appear unusually bright red because the oxygen is still there but cannot be used by the body. The most common blood agents are cyanide-based chemicals, such as hydrogen cyanide, and arsenic-based gases, like arsine. Cyanide stops the body's cells from producing energy, while arsine destroys red blood cells, preventing them from carrying oxygen properly. Because of how quickly they act, blood agents can be deadly in a very short time, although antidotes exist if treatment is given immediately. Riot control agents. Riot control agents, often called tear gas, are chemicals used to temporarily stop people from functioning by causing strong irritation to the eyes, skin, and respiratory system. These chemicals work very quickly, usually within seconds, by irritating whatever part of the body they come into contact with, such as the eyes, nose, throat, or skin. Common types include CN, CS, and CR, which are used by law enforcement for crowd control and by individuals in products like pepper spray for personal protection. Once exposed, people may experience intense tearing, burning eyes, blurred vision, a runny nose, coughing, chest tightness, difficulty breathing, and skin irritation. Some may also feel nausea or begin vomiting. The effects are usually short-term and often improve within 15 to 30 minutes after getting away from the source and cleaning off the chemical. However, in higher doses or longer exposures, more serious problems can occur, including severe breathing issues, eye damage, or even life-threatening complications. These agents can be released into the air as fine particles or droplets, meaning people can be exposed by breathing them in or through contact with their eyes or skin. While they are designed to be non-lethal and temporary, they can still be dangerous, especially in enclosed spaces or with heavy exposure, which is why proper care and quick decontamination are important after contact.